the next Sonder Youth Services webinar for today. Today we're having a chat about the role of peer workers and functional recovery workers in mental health and suicide prevention services. My name's Claire and I'll be your host today. First up, we'd like to acknowledge the Aboriginal and Torres Strait Islander people as the first peoples of Australia, and we recognise their cultural, spiritual, physical and emotional connection to their land and pay respect to elders past, present and emerging. Welcome today. If this is your first time joining us, thank you for joining us. We've been doing these webinars now for about 2 months, and they've been a really great opportunity to sort of build and connect. So Sonder is one of the largest providers of youth mental health services in the Adelaide metropolitan region, and we'd like to acknowledge our funding bodies, particularly the Adelaide Primary Health Network, in enabling us to provide these services. So these webinars are a great opportunity for us to build knowledge sharing and interagency connectedness within the youth mental health sector in South Australia, and today's another great example of that. And we have a few more coming towards the end of the year, so feel free to look out for the calendar if this is something that interests you. So just a bit of housekeeping: if you're new to Demio, there is no video function, but if you have your mic, we just make sure you mute it. And then if you have any questions along the way, pop them in the chat bar on the side there, and towards the end of the presentation we'll get to those questions. So I'd like to introduce our lovely presenters that we have here today. So we have Garis and Amira Healy. So Peru is a psychosocial recovery lead and occupational therapist committed to providing recovery-orientated and evidence-based therapy to people experiencing mental health difficulties and or disability. She's a skilled clinical leader of functional recovery programs in both the NGO and government sector, and her special interests include lived experience workforce, functional recovery, and trauma-informed care. And we also have Amira with us, who is a family peer support worker at Headspace Adelaide. She's experiencing connecting with families during a difficult time in their lives, and she's passionate about building hope and validation in families. Thank you guys for joining us, and we're so excited to have you here today. I'm now going to hand over the stage to you guys, and you can take it away.
Awesome. Thank you very much, Claire. So my name's Prue. I'm the psychosocial recovery lead at Sonder Youth Services. I guess my role is around coordinating functional recovery workers and peer support workers across our Headspace early psychosis program and 2 of our complex care funder programs, Emerge North and Emerge South. And I also oversee the employment program in our Headspace centres, which uses the individual placement support model. I guess I'll just kick it off by talking about functional recovery, and then I'll hand over to Amira for the second part of the talk. Functional recovery is the return and reintegration for young people into previously valued roles and interests and activities, particularly for young people coming into youth mental health services. Is also about the development of new skills and exploring interests. One of the things that, one of the reasons that functional recovery is so important for working with young people in mental health services is, I guess, they come to us at a time in their life when they are still developing their identity, and they might be individuating from their family or building skills for independent living and building all of their functional skills. And so when the person might experience some difficulties with their mental health, like mental health, ill health or mental distress, I guess they're coming in at a time where they're developing all those skills, and if we don't provide early intervention around their functioning, the experience for them will be that they're sort of on a, I guess there's a bit of a gap in the developmental trajectory for them than what their peers who hadn't experienced mental health difficulties might be. So I guess as a mental health program, we focus on functional recovery really early, and we see it as equally as important as the symptom remission of their mental health experience. The other reason we focus on functional recovery is because often young people come to us and their number one goals are to be doing the same things that their peers are doing. They want to be working, they want to be re-engaging with school, and they want to be socially connected. So for us to be able to offer that support that's really I guess targeted for what their goals are is really important. And the other reason we focus on functional recovery earlier on is, I guess the traditional review might be that you focus on the mental health symptoms, but if you're focusing on functional recovery really early on, we're trying to keep them on that same developmental trajectory, and so the longer term outcomes of functioning are sustained, and that has, I guess, less of a burden in terms of cost. So we try and avoid people getting on Centrelink payments or requiring support with supported housing and things like that. I'm an occupational therapist, and so one of the frameworks that kind of underpin the work that we do is the model of human occupation. So the model of human occupation looks at all the factors that influence engagement in meaningful activities. We focus on what motivates young people, so we focus on their interests, what their values are, and we think about their self-efficacy as well. We look at patterns of occupation, so what kind of roles do they identify with, or what do they want to identify with, what responsibilities are associated with those roles, and of course our roles and responsibilities make up what our routine is. We look at performance skills, so we look at process skills, motor skills, and of course communication, which tends to be quite a large focal point working with young people. And we look at the environment, so the social and physical environment that I guess enable or disable someone from engaging in the activities that they need and want to do. The key areas, I guess everything we do is focused on the young person's goals, but the key areas that we might provide support in terms of functional recovery are personal and self-care functioning, social and engagement and leisure activities, productivity, so work and study, and of course instrumental activities, so living skills, living independently, budgeting, managing a house, and everything associated with sort of functioning as an adult. Some of the examples of interventions we provide in our one-on-one services are things like transport training, and sometimes that's about not just about developing the skills for managing public transport, but it might be around the social anxiety that's associated with that. It might be just getting a bit of a routine for engaging in those activities. We look at what you have to do to be in a house. So it might be shopping and budgeting and cooking healthy meals, and all those kind of household management tasks that we look into. Also navigating the Centrelink system or navigating any kind of work and study systems where things like access plans might be required. And then we also spend, I would say, a fair chunk of our time talking with young people about social skills and social communication, both in a social sense but in a professional sense. So when they engage in work or study, some of the things that we're able to do in addition to the one-on-ones is offer a group program. Our group program is graded, so again, it's always guided by the young person's goals, and we try to tailor as much of it as possible to the young person and where they want to be. We have, I guess, sort of entry-level groups that are around social participation, and we might actually have a lot of scaffolding from our workers. So it might be things like lots of icebreakers or supporting the young person with how they're going to engage in conversation, and doing lots of sort of leading questions and things like that. And then we grade it up a little bit. So it might be that the young person goes to a coffee club where there's not as many icebreakers, or the conversation topics haven't been chosen, and it's a bit of accountability and opportunity for those young people to sort of start the conversations and continue them and end the conversations. And we might provide sort of one-on-one feedback to support the young person in doing that. We also have I guess more social recreation groups. So the idea of that, apart from just being wonderful and fun, is around sampling lots of different activities to find out what someone's interests are, to try and build up their sort of balance of activities in their day. And sometimes we can also focus on activities that build up mastery. So we'll build the skills and the confidence in doing that task. We also then move on to more personal development, or I guess therapeutic groups, where we might use therapy as the sort of informing what the group looks like. So, for example, we have an ACT group, and we are able to ask our peer workers to be co-facilitators in that space so that they can draw on their experience of having use those skills in practice. So we're sort of able to demonstrate what theory looks like in practice, and then it becomes a space of I guess sharing wisdom amongst all the people that are attending the group. And the other kind of group that we offer is more of a community, being part of a community kind of group. So we have, as an example, a couple of LGBTIQ plus community groups, Gender Dive and Q Space, and that's about, I guess, a safe space for people to explore their sexual or gender identity, and and draw on the experiences of other people and learn from each other. We have different kinds of activities where, you know, they might be able to explore their gender identity through clothing or, you know, nail polish and things like that. But also we might have like a question box where people ask questions that they're all sort of experiencing, and then hear how other people are tackling those difficult experiences and problem solve together. The other part of the function recovery work that we offer is our employment programs. So our employment programs use the individual placement support model. We have a couple of them in our headspace centres, and as I was saying before, one of the key goals that young people come to us with is about getting into employment and education, and it's really important for them to be able to start working on those things as soon as they identify them as important. The sooner we can provide the intervention, the better the outcomes, and the longer term the outcomes can be. So there's a couple of really great things about the IPS model, and one of them is this idea of zero exclusion. I think traditionally when someone came to us and wanted to get into work, would have a really strong focus on looking at their mental health symptoms and trying to sort of reduce them or get them into remission. And then we would focus on the functioning side of things, whereas this model takes on the idea that we need to support the young person as soon as they identify that as a goal and maintain that motivation and that momentum to get them into the role. So essentially we use zero exclusion. So it means that if the young person wants to work with us, we work with them. Another really cool part of the employment model is we have employment workers in those positions, but we work really closely with the mental health team. So we're really well integrated. And that gives us an opportunity to provide holistic support for that person and plan with the young person about what kind of jobs are the best fit for them, what kind of strategies they might need to implement, and what kind of modifications might work for them in the workplace. So we can write sort of support plans for that young person with the clinician's input, with the young person's input, and then also provide support to the employer as well, with the ultimate goal of being able to keep them in the work. Another key component, and I should mention as well, like all of the support that we provide is person-led. So the young person, if they want to work in a particular place, we will support them to work in that place. We obviously provide education about, all of their rights and their responsibilities, but it's all person-led. And the other component of what we do is our workers are with the young person from the beginning to the end. So I guess something that we're able to offer is post-placement support. So once a person gets into a position, often I guess that's a time of increased stresses. It might affect their mental health, or there might be, as we all experience lots of different challenges when we first came into the workplace and continue to experience in the workplace. So our workers can provide time unlimited support to those young people to keep them engaged in the role, or if they want to work in a different industry, we can still work with them while they're working to look for another career pathway. And the other part, so I guess those areas cover off what we do in terms of function recovery. Another huge component of what we do within mental health services is around a young person's personal recovery. So someone's personal recovery is, I guess, how they make sense of what their experience is, and how they review or adapt their goals and values based on their experience. We're really fortunate to have a number of peer workers who work in our service and provide that invaluable support to young people and to their families. We have about, I think, peer workers make up about 10% of our workforce here, so we're really proud of the work that we're doing in the peer workforce space. Peer workers are people who draw on their lived experience of mental ill health or mental distress, but more importantly, draw on their experience of recovery and the skills that they developed through their experience of recovery. And then they're able to, I guess, use those skills in a way that they can share with someone else who might be newer to the experience, and come from that perspective of having walked a very similar path and supporting them and providing some strategies that might have worked for them. Our peer workers draw on principles of hope. They want to instill that hope that recovery is possible. They're role models, so that sometimes means role modelling self-care. They're empathetic, and they're person-driven, and they're recovery-orientated. They also are draw on or focus on developing mutual and reciprocal relationships, which is one of the nicest things that I really like to see in action and to hear about in supervisions, because it means that they can create a space with a young person that has no power imbalance, and it's a space where the two of them can talk about shared experiences and they can actually learn from each other. So it really sort of provides a space where the young person has a lot of skills and they can draw on the things that they've already learned to support someone else as well, and build their confidence in how they can, how they can keep going on their recovery. The reason I've asked Amira to be here today is because Amira is one of the family peer workers in one of our programs, and wants to give us a bit of an idea of what that looks like in practice. So yeah, I'll pass over to you now, Amira.
Thanks. So very similar to the peer support workers, I do all the things that Prue had mentioned. However, I work with the families. So my role is to work in a collaborative way to ensure the, well-being of the young person, but have the family's input as well. To provide that missing piece of the puzzle. A lot of mental health settings or settings in general can often judge or dismiss the families, but having a role like mine, I can really include their perspective and get a really big understanding of the dynamics of what's happening in the family home as well. The focus areas that we have that I focus on with my families is self-care, which is a huge important part, especially when you're going through something quite heavy or a crisis point, I should say, and especially making them realise that their mental health and well-being is important as well, because you can't pour from an empty cup. And then on top of that, I help them access further knowledge and resources if they are needing support in any areas, and also to help them show them that, there are things like Centrelink that can be a pain to get through sometimes, and we can walk together through that. I also provide a lived experience similar to the peer workers, but I suppose mine was more that I cared for someone that went through something similar or the same that some of these families are going through. And I provide that validation and normalization with that reciprocal relationship, which I learn a lot every single session, and I'm sure the families do as well. I do know that with the normalization and the destigmatization, it's a huge feeling to have to really understand, to provide that understanding for someone is quite huge, to make them feel that they've been seen and heard and connected, because it can be quite isolating going through what they're going through. And I do generally like to show them that there's glimmers of hope throughout their situation as well, which they might not always realise because everything is quite overwhelming. Going through my own lived experience, I never had the opportunity to connect to a family peer support worker. And so one of the relationships that stood out most to me was when I was in hospital with my loved one. There was a nurse that had gone above and beyond, and she really took the time to listen and validate what my situation was, and to provide that, things are actually going to be okay, even though things are really difficult now, but it was okay to feel what I was feeling and I could keep going. And I think, regardless, people will never know what you're going through. They can't, but they can go through a similar path and provide that normalization, which ends up being the validation that you need to get through. When I started here, we came across a quote that I really, really resonated with, and that's by Dr. Louise Byrne. She quotes, "Yes, we all have adverse experiences, times when we are down, anxious, stressed, paranoid, etc. But in the lived experience movement is defined as challenges that have caused life as we knew it to change so significantly that we have to redefine ourselves. And I find that a lot of families don't realise that's what they're doing, and I get to help them unravel and shine through all of the difficult times. Is that pretty much it? Yeah. And I suppose giving that space to families, it just really is about human connection. Yeah.
Thank you so much for sharing. It's really cool, I guess, from my perspective, being also part of the Headspace Adelaide family, that 10% of our workforce is peer workers. That's incredible. And I think it just goes to show the importance and validation of having that lived experience and bringing that with these young people and their families along the journey that they might have with us. Does anyone have any questions that are listening in? You can put them in the chat on the side if there's anything specific. You might be getting lucky. Okay, well, in that case, thank you so much for coming along and sharing your perspectives about the importance, I guess, of functional recovery and peer work within the mental health sphere. I think it's definitely a place that has so much importance and validation as part of our model, and I think it's definitely thanks, Emily. I think definitely going forward as well, peer work is seen as having this other extra pillar that's really important and core to everything we do. So we're really grateful to have you, Amira, and Peru as well as part of our team. Kay's got some questions. So how do services refer to your different programs?
So we have online community referral forms. So we have like most of the complex care programs I was talking about emerge. You can access them via the community referral forms that are the same referral form for our Headspace centres. So you can find them on our websites, Claire. You can also give us a call. We get a bit more information and then we can direct the referrals into the right program. And we also, do we go by the CRU, Claire?
Yep. So if people are GPs or if they've got a mental health treatment plan, the central referral unit can also help you point you in the right direction for what service might be best for you as well. Cool. I think there's a question here about neurodiversity.
Yeah. What was the question? Is a grad dip in counselling
maybe enough? Or
is there room for that?
Anya, do you mind just clarifying what that question is? Is it around if you've done the training in counselling, whether you would have a position in the program? I think if I'm interpreting it correctly, depending on what role, we have different, I guess, credentials for each of the roles that we have within the programs. Yeah, okay. We have different credentials for the roles that are in our program. So some of our roles require allied health professionals, so people who can be registered either with APRA or through the social work, accredited through the AASW, which is that Australian Accreditation for Social Work. And then we do have some positions that probably, like some of our functional recovery workers, could also look into someone who's had a grad dip in counselling as well.
Great. Well, there's no other questions, it doesn't seem like. So thank you so much for joining us. It was great to, I guess, touch on that topic. We've recorded this session, so if you missed any others before, if you want to listen to this again, it's up on the Sonder YouTube page, and so you'll be able to look back. Okay, just wants to clarify all referrals to different programs through the Emerge paperwork referral.
So we'd be using the community referral form. Yeah, so as Claire mentioned before, there we can have a mental health care plan via the central allocations unit, or the community referral form, which is available on Headspace websites, or you can fax the referral form in, or give us a call as well. And then we sort of do an intake and work out which program that young person would go into. And that's just for the Headspace and Emerge programs.
Awesome. All right. Thanks, Kay, for your question. And thank you so much, Prue and Amira. Have a great rest of your days.
Beautiful. Thank you very much.
Thanks, everyone.
Bye.